Alrighty. Hello, everyone. Welcome to another one of our Dental Shadowers virtual shadowing sessions. Today we have Dr. Luna here, who's excited to present to us. For those of you who are live, thanks for coming. And for those of you who are going to watch later on YouTube, thanks so much for checking out our channel. We have a lot of virtual shadowing sessions up there, so make sure to watch some other ones as well. But I'm going to hand it off to Dr. Luna.
Hi, everyone. First of all, I just want to say thank you to Taylor and Shaylin for inviting me to participate in this pre-dental event with Dental Shadowers. I've prepared a little presentation just kind of describing who I am, how I became a dentist, and I'm going to share some of the restorative cases that I've worked on. Here we go. So my name is Crystal Luna. I'm a restorative and cosmetic dentist living in Chicago, Illinois. I'm an associate dentist at a private group practice just outside of the city. And some fun facts about me: I've been married for 2 years, no plans for kids. I like to lift at the gym, try new restaurants, and travel. So what is a dentist? I'm sure if you guys are pre-dental students or existing dental students, you already know kind of what a dentist is and what they do. But a dentist is a doctor, a scientist, and a clinician dedicated to the highest standards of health through prevention, diagnosis, and treatment of oral diseases. We must evaluate the overall health of our patients while also advising them about disease prevention. We perform clinical procedures. We perform clinical procedures in order to restore the patient's dentition, and we also identify, diagnose, and treat several conditions. So the road to DMD. So the road to becoming a dentist is certainly a long one. I personally decided that I wanted to pursue dental school when I was a senior in high school. I started chatting with our family dentist and my orthodontist, who gave me a rundown of like the long journey ahead. And at that time, I didn't really understand how competitive the journey would be, but I was always a good student. Like, I took honors classes and AP classes in high school, so I wasn't really intimidated. And I had my family support, and my doctors became my mentors. So with their support, I dove into it straight ahead. During my senior year of high school, I started researching dental school programs, application requirements, and prerequisites. And at that time, I also knew that I would be starting my dental school journey at a 2-year college or a community college. So 2 weeks after I graduated high school, I went to my local community college. I met with an advisor, and I outlined what courses I would need to take each semester in order to transfer 2 years later. And we also made sure that those courses that I was taking would be 100% transferable to the 4-year university, and that they would apply towards my bachelor's. So while I was at the College of Lake County, which is a community college just like northwest of Chicago, I took several prerequisite courses, including biology, chemistry, OChem, physics, calculus, and English. And then after 2 years, I transferred and I moved into the city, and I transferred to the University of Illinois at Chicago. While I was there, that's where I took my upper level science courses, such as anatomy and physiology, genetics, cell bio, microbiome, and biochem. And then I finally earned my bachelor's in May of 2015. So during my time in undergrad, I was involved with various student organizations. I would recommend that you vary your undergraduate activities, but also try to show longevity in your application. So for example, I personally would commit to a student org for a minimum of 1 year. I was an UIC honors college grad. I was a freshman orientation leader. I was in the pre-dental club for 4 years. I did undergraduate research for 1 year with a minimum of 10 hours per week. And I did various volunteer and shadowing experiences. And I also worked part-time for 2 years as an orthodontic assistant. So after graduating with my bachelor's, I decided to apply to dental school. So I wanted to demonstrate on my application that I could handle a rigorous course load and perform well with 2 years of upper level science courses at the university level. So this was a strategic decision on my part because I was concerned that dental programs would judge me poorly for having taken 2 years of prerequisite courses at a 2-year community college. And I mean, I would say that it worked. I graduated from UIC with a 3.8 GPA. That's magna cum laude Latin honors. I received academic distinction from the University of Illinois Department of Biological Sciences, and I made the dean's list every semester at UIC. So that same summer, after I graduated with my bachelor's, I applied to dental school and I took my DAT all in the same summer. That summer I got a 21 on my DAT. I decided to apply to 8 dental schools, and I was invited to interview at 6 programs that fall. Actually, excuse me, 4 programs in the fall, and then 2 more like in January after first decisions. So I went to the 4 that were, during the fall, and then by December 1st, which were first decisions, I had those 4 acceptance letters. So I did not end up going to the last 2 interviews in January because I already had a couple of schools to pick from. I knew that UIC was my top choice, so I immediately accepted that offer. And like I said, I declined to interview at the other 2 programs. So then during my gap year, I was working as a dental assistant at a private office. And that following year, in the fall of 2016, I started my first year of dental school at the University of Illinois at Chicago. And this is my white coat ceremony picture. So some advice that I could give all of our pre-dental students that are checking in today is, I think my biggest piece of advice would be to start early and to have a plan. Seek help from your academic advisors to plan your coursework, network and consult with current dental students, as well as dentists, specialists, and mentors for advice. I think that the sooner you have a plan, the better. And then just stick to the plan and work hard. For the DAT, I would consider taking the DAT after completing your basic science courses like bio, chem, OChem. For many students, this will probably be the summer after your second year of undergrad, and I recommend taking it early just because that information will be fresh in your mind. And I would definitely recommend that you study long and hard and try to kill the DAT, because that's going to be a big component of your application. I personally used Kaplan, and I used the DAT boot camp before I took the DAT. For your personal statement, my biggest piece of advice is to make sure that the message of your personal statement rings true to you. If you identify strongly with the why you want to be a dentist, then it's 100% going to shine through in your statement. And I would give you some bonus points if your why is reflected in your extracurricular activities, such as volunteer work or research opportunities. For your letters of recommendation, I would say to convey your intent early. At the beginning of the semester, I had met with my professor and explained that later I would be asking for a letter of rec. I would recommend that you ask your professor in person and then send a follow-up email about that conversation that you guys had. And then work hard, obviously, to excel in that class, so that at the end of the semester, when you touch base and say, hey, I'm checking in, I need that letter of rec, you did well. And lastly, for your letters of rec, make sure that you show up to office hours, talk to your TA, because they're certainly going to be asked about you by the professor. Number 4, I would say research the dental schools that you're interested in applying to and determine how they compare. Like, is it a research-based program? Is it curriculum? Or what is the curriculum like? What's the class size? Is it urban? Is it rural? So try to figure out where you would fit or how you would fit into each program, and research the average stats of the current dental school, dental body, research the stats of the current student body. So for example, I know that ASDA sells like this book where they kind of outline the stats of the current student body, but you don't need to buy that book. Just log into Google and search the school that you're interested in, and you'll be able to see the student body's DAT score, GPA, if they have a bachelor's or a master's, etc. So when you have that profile information, then you can determine areas of improvement and set goals for yourself so that you are a competitive applicant. And the last piece of advice that I can give to our pre-dental students tuning in today is to believe in yourself. I know that this can be hard. Oftentimes we are quick to believe in someone else, and we're so supportive of someone else and their goals and their dreams, but we cast self-doubt onto ourselves. And there will be difficult days along this long journey, but you have to be your biggest cheerleader in order to stick to the long road ahead. So work hard, believe in yourself, and just know that you can do it. So life after graduations. So in 2020, I was a D4. I had just finished taking my patient boards on March 1st of 2020, and then the whole world shut down. So our class thought that we were going to be on an extended spring break, but we never went back to school. And luckily, I had passed my patient boards and I had completed all of my clinical requirements, so I didn't have to return to school that summer or retake my boards. Our class just basically finished didactic over Zoom like we are right now. And by May, it was clear that COVID was not going away anytime soon. So our graduation ceremony was canceled, which was really disappointing. And my now husband, then fiance at the time, we also had to postpone our wedding that year. So COVID was quite awful, but he went remote and I really struggled to find a job in the thick of COVID. You know, I was a new grad, I had no experience, so finding a job in that environment was quite difficult. So one day, my friend from dental school, she called me and she had moved to DC to be with her boyfriend. And she told me that the office that she was working at was looking for a second Spanish speaking provider. And so after talking to her, my fiance, my family, we decided to move so that I could get that work experience. So we moved to Virginia in July of 2020. And I spent my first 2 years practicing as an associate dentist in the Northern Virginia area, just outside of DC, at a small private practice. And that population that I was providing care for was majority Spanish speaking. And then after 2 years in Arlington, we decided to move back to Chicago in order to be closer to family and friends. So last May of 2022, I started as an associate dentist at a large private group practice in Wheaton, Illinois. So Wheaton, Illinois is a suburb about 25 miles west of Chicago. And in search for a new practice, my biggest desire was to find a mentor. And I was lucky enough to find that in the practice owners, Doctors Brian and Danielle Bauer. So they are very dedicated to career development for all their employees, spanning from dental assistants, hygienists, and the business team. We are collectively sent to conferences 2 times a year to take relevant continuing education courses. And then we have lunch meetings where we share what we learned with the team so that we can determine how to implement these new ideas into the practice. And the Bauer team is quite large. As you can see, this is a photo from our Christmas party in December last year. Not everyone is in this photo, but we have 3 restorative dentists. We have an orthodontist, a pediatric dentist, 7 registered dental hygienists, and then assistants and business team members, in total about 45 employees. Yes, it's quite big. Daily life. So my daily life. So day to day, I practice 4 days a week, Monday through Thursday. I work 8 to 5 with a 1-hour lunch break. That seems to be like the typical schedule. I have, like in Arlington, we worked 9 to 6. So the same amount of hours, but just a little bit later to accommodate people that were working or at school. I'm off on Fridays and our office is closed on the weekends. I have 1 restorative column, which usually consists of limited oral exams, extractions, crown preps, fillings. And then we don't have many patients that require like removable prostheses like dentures. And I also personally don't love endo, but I will take on straightforward anterior or premolar cases. Luckily, my mentor, Dr. Bauer, he loves all things endo, so I refer difficult cases to him in-house. And then probably 1 to 2 times a month, I'll have a larger patient case that calls for implants, extractions with socket preservation, and recently I started a veneers case. And so apart from my personal restorative column, I'm also responsible for checking about 3 to 5 hygiene columns per day. The hygienists each see 1 patient every hour. So in total, I probably see anywhere from like 30 to 50 patients per day. And the majority of those are hygiene checks because I'm bopping around in between my own patients, but nonetheless, it's busy. And when it's slow at work or if I get a cancellation, I will read journals that I share with Dr. Bauer. There's always a stack on my desk, and it's actually nice to get some questions answered and just to learn about what different institutions are doing. And this picture over here on the right is a picture that we took at Disney's World Epcot this past May. Several members of our pediatric and business team attended the American Academy of Pediatric Dentistry's annual conference in Orlando. So members of our team took several CE courses that weekend. So yeah, a few times per year, my weekends are dedicated to CE or to attending conferences, which I do enjoy. So now I'd like to share some of my cases. Like I had mentioned before, the majority of my cases are usually restorative, like fillings, crowns, or preventative, like actually doing exams for hygiene checks. As a dentist, you must diagnose and treat oral diseases, but there's also like an artistry component that comes into restorative dentistry, which is what I love. So here is a single crown case that I completed using a digital workflow. As you can see, tooth number 28 was previously root canal treated, and it had an existing core buildup that got recurrent decay. So after excavating the decay and restoring the tooth with a new core buildup, I prepped the tooth for a crown. I scanned and I designed the crown using 3Shape Trio's design studio. And then we milled the crown, and then I characterized and glazed it myself. And here you can see the finished product down here on the lower right. So here you can see that like the patient's adjacent dentition, she has multiple shades in her teeth, and she also has these little like white spots. And this is where the dental artistry and tooth characterization comes in that I really enjoy. Okay, this is a second restorative case in which I worked with a periodontist. So the photo on the top here, this is the patient's before photo, and his chief complaint was, I don't like these jagged edges. He was feeling unhappy about the fractured incisal edges and the front four teeth, and also the size of the teeth. So you can see that here that the patient had an existing zirconia crown on tooth number 9, and then their natural teeth 8 and 10, the incisal edges are jagged and fractured, like they said. So as a dentist, not only do we have to determine like what we need to restore and how are we going to do it, but it's also important to figure out why this happened in the first place. And so in my smile design analysis, you can see that the patient just has a very deep bite. And he also was a habitual clencher and grinder, which led to the breakdown of his front teeth. So I did a little smile analysis for him, and I proposed that we improve the gingival zenith, which is these little black lines down here. And he didn't want to do ortho, which is fine, but so there's nothing we can do about the deep bite, but at least we can improve the contours of their teeth. So first thing I did was I referred the patient to perio for crown lengthening in order to improve the gingival zenith. Here you can see that the periodontist did a little gingivectomy and crown lengthening to increase the height of the incisors. And then the photo over to the right is 6 weeks post-op. So once the patient was fully healed, they returned to me to actually restore the front 4 teeth. So here we have, I removed the existing crown on tooth number 9. And you can see that the prep is quite aggressive. The tooth is a little small, but we had to refine it in order to fit some zirconia, some Emax crowns, excuse me. And then these are my finished preps for 7, 8, 9, and 10. Then I scanned the patient and I designed the crowns, again, using 3Shape Trio's design studio. And then we milled the crowns, and this was the finished product on crown cementation day. And like I mentioned before, the patient was a habitual clencher and grinder, so we made a mouth guard for him after crown cementation so that he wouldn't chip these brand new beautiful crowns that we worked so hard on. So during the week, as I previously mentioned, or during the year, as I have previously mentioned, I do take a lot of CE courses. So since graduation, I've made it a priority to take several CE courses. And the goal, of course, is not only to expand my clinical skills, but also to provide my patients with the best standard of care. And in 2022, I took over 100 hours of CE for implant case planning, socket preservation, and with my mentor support, I've started a few cases this year. So pictured here is a case that I started earlier this spring. I planned implants for sites 4 and 5. If you look closely, you can see that there are remaining root tips of number 5. So tooth number 5 was an immediate extraction, was an extraction with an immediate implant placement. And here are those implants in sites 4 and 5. And you can see here he had 5. We extracted that and then placed an implant same day. And we're currently in the process of restoring those implants. Here's another case that's in process as well. I took a CE course for socket grafting with extractions and PRP. So using the techniques that I learned from this course, we extracted tooth number 19, which is here on the CBCT. This site was bone grafted, and then the patient is scheduled actually next week to get the implant. Let's see. And finally, here's another recent implant case that I started this summer, and these implants were placed in sites 2 and 3. And then earlier this winter, I don't know if you guys are familiar, but Chicago has a huge midwinter meeting every year. It's like a huge dental convention. It's like a 3 or 4 day thing. It's huge. And you can take CE courses. There are some that are free, as well as some that you can like sign up for and pay. And Dr. Leanne Brady, if you guys are not aware of who she is, definitely look her up. Her anterior veneers courses are awesome. So she came to Chicago and I signed up for one of her courses called Mastering Anterior Veneers. And this was a great intro for veneers, which is a skill that I want to improve. So, and I also randomly will search for cost-effective self-guided CE, such as this one that I found from Dental Town. So CE is it can be quite expensive, and I'm talking like tens of thousands of dollars. But if you join like ASDA, your local city chapter, like the Chicago Dental Society, you can get access to some like self-guided lecture style CE. Like this one was 1.5 CE hours. It's not like it's a lot, but it's a great way to kind of learn the basics and then determine what more you need to know. And in this way, I can continue to find CE that helps me fill in those knowledge gaps. So finally here, I'm going to share an anterior veneers case that I started last month. The patient was unhappy with the width of her teeth and the size of her teeth. On the bottom picture on the lower left here, you can see that tooth number 7 had some composite bonding, and her chief complaint was that this tooth was too wide. She naturally had a diastema she naturally had a diastema between 7 and 8, and a previous dentist only restored 7, but she was unhappy with the width, unhappy with the color. You can also see that the contours of her teeth, they're a little tapered, kind of giving you that trapezoidal shape. So she kind of wanted a whole smile design. She wanted to change it up. So we prepped teeth 7, 8, 9, and 10 for porcelain veneers. And over to the right is a picture of the patient in her temporary restorations. She will be returning next month for the final restorations. So some future CE that I'm planning to take includes a Botox course from the American Academy of Facial Aesthetics and more veneers. My employer is currently planning to send all the associate docs to a dental conference in LA this November. And like I said before, I enjoy going to conferences for CE. I usually try to drag my friends with me if I can, and it's always nice to see colleagues there. All in all, I will say that the learning doesn't stop after dental school. It only continues, and it's important that you not only accept this, but also be dedicated to this truth. Because only by continuing to learn can you offer your patients the best and updated standard of care. And this also offers you the opportunity to expand on skills that you enjoy or that you are interested in. And like I hope I demonstrated, I personally love restorative and cosmetic dentistry because it demands a certain artistry and attention to detail. So that's all I have for you guys. I just want to reiterate that, I know that the journey ahead is quite long, but just remember, nothing worth having comes easy. You guys can do it. Just believe in yourself. And I look forward to seeing you guys again. Thank you so much for having me.
Thank you so much, Dr. Luna. That was a very informative presentation. I personally really enjoyed it. So now we're going to move into our Q&A session for the day. So if
Awesome.
all of you would like to direct your questions into the chat, and then Shaylin here will be facilitating. So she'll read your questions off to Dr. Luna, who can then answer
Awesome.
them.
Thank you.
And then it did look like we got a question right away that's not pertaining to the session, but all of our virtual shadowing sessions can be uploaded on your dental school application. Dental schools may not accept them as actual shadowing hours these days, since the COVID pandemic is not at the heights that it once was. But all of our virtual shadowing sessions and any sessions that we host on our platform are really good supplemental experiences to have in your application to show that you are dedicated to the dental field. You're curious about learning things as well. So they might not count as actual shadowing hours, but they will always be an amazing supplement to have on your application. So I hope that answers that question. And then I guess my first question for Dr. Luna is I really enjoyed hearing about your time at community college, and that's not a path that is super common to see in the dental field. So I really thought that was cool. What advice would you give to those students who are considering doing community college before pursuing their dental journey, or those who are currently in community college and want to go to dental school?
I would honestly say that planning ahead is the biggest, like the best thing you can do. Like I previously mentioned, like when I was in high school, before I even started, I had a 2-year plan, you know. I knew what courses I was going to be taking every semester. I researched what 4-year universities would accept these credits and that they would be 100% transferable towards my degree so that I wouldn't lose any time. So just planning ahead, doing your research, and then confirming that information is super important. I remember calling universities and just making sure, like double checking, making sure that my courses were going to transfer, all of that. So I would say, just plan ahead, have a plan, stick to the plan, double check everything, just confirm that it's going to transfer and that it's going to fulfill the requirements that you need for that 4-year bachelor's. And my other piece of advice is that don't get discouraged. Like, I think that there is a stigma associated with going to a 2-year community college, and people will think that you're not going to achieve the bigger goal that you have because you started there. That's not true. So don't listen to the naysayers, stick to your plan and you'll be fine.
Okay. Another question is, what was the most challenging aspect of dental school?
The most challenging aspect of dental school, I would say honestly, just like learning how to study. Like the University of Illinois at Chicago, they utilize a method called small group learning, which I'm not sure, Taylor, if you're familiar with that style of learning, but it's kind of like they give you a case, and then from that patient case, you have to come up with the questions and determine what knowledge you need, and then go and research it, and then come together in your group and go over it together. And like there are learning objectives that you have to fulfill, and your professor, your facilitator is supposed to help you get there. Like it was very different. Like I was used to, like an undergrad, of like going to a lecture and they give you the slides and you memorize the slides and you learn the information and then you regurgitate it on a test. But small group learning was a huge like mental shift. It's the style of learning is meant to develop your critical thinking skills. So after like a semester, like I finally got it. But I think that was the most challenging aspect of dental school, is like learning how they want you to learn and rethinking a patient case in the way that a doctor should, if that makes sense. It's like now it's on you to change the entire way that you ask questions and like figure out a problem. And of course, I would say also just like the volume of coursework, like the volume of material that you have to study, that also was challenging. Just trying to learn as much as you can, study as many hours as you can. Like it was hard.
Okay. As an undergrad, what do you recommend to enhance your dental school application?
I think the best thing you can do, honestly, is just do well in school. Like that is number one. Number one. Like you have to do well in school, get a great GPA, be involved in student organizations. So not only do you have to be a good student, but you have to demonstrate leadership and demonstrate your commitment to the community. So make sure that you're involved in different student organizations, volunteer, just try to be as well-rounded as you can. I'm sure that this is the exact same thing that they tell you every time, but like get a good DAT score, get a good GPA, and just demonstrate leadership or just like your interest in dentistry.
How did you practice manual dexterity before dental school?
That's a good one. I didn't. I really didn't. I think that like I had classmates that like loved playing video games and their manual dexterity as well as like their perceptual ability was so much better. So I don't know if like that's a good like piece of advice. But I really didn't. I think that it was just a skill that I learned in school along the way.
How is it working in such a large dental practice?
I actually really like it. I really like it. There's a lot of people, a lot of different personalities that we need to navigate. But the Bowers run their practice like very very well. Everyone operates under a standard operating procedure. So that means like we have like a manual guide for every single thing that you could possibly think of. Like, for example, there is a standard operating procedure for how to do a filling. And like step number one will be greet patient using like greeting SOP, like standard operating procedure. Like there is a standard operating procedure for even how to introduce yourself and go grab the patient from the patient lobby. Like there are very clear steps. And the reason that they developed all these SOPs is so that it's streamlined along all the assistants, all the doctors. We're all using the same materials. We're using the same script when it comes to our patient care so that they receive the same experience every single day. So in that way, making sure that we're all following the same protocols, working in a large dental practice is quite easy. I think that if we didn't have those standards in place, then it would vary. You know, the patient experience would vary from doctor to doctor, from assistant to assistant, or even from the hygienist. It would differ. But I love it. I think that the practices run very well, and I actually enjoy like getting to see so many different people. It's great.
With moving to get experience working in an office, what made you decide to work straight out of dental school instead of residency?
So I never really was interested in specializing. And when the pandemic hit, like at that point, it was too late to apply to GPRs. So that wasn't really an option. I just kind of like, I just continued with the plan, which was to graduate, get a job, and start practicing. Yeah, I feel like by March, end of March, when we were on full lockdown, it was already too late. My classmates who had applied to GPRs, they were already accepted, like they already knew the positions, you know? So it wasn't really like a choice that I was given, if that makes sense. But I never really wanted to pursue residency. I felt prepared by my education at UIC. I didn't think that I needed a GPR, and I wasn't interested in specializing.
I am a sophomore in college that has switched from the pre-medical route to the now pre-dental. Last
Mhm.
year, my extracurriculars have not been dental related. Would this even be beneficial to my dental school applications?
Can you read the question one more time?
Okay. It says, I am a sophomore in college that has switched from the pre-medical route to pre-dental. Last
Okay.
year, my extracurriculars have not been dental related. Would this even be beneficial to my dental school applications?
I think it would still be beneficial because you're still demonstrating community involvement and volunteering within your community. So you can still spin that experience in a way that you're demonstrating your commitment to the community. Does that make sense? I don't think that you necessarily have to work in a dental office in order to demonstrate your interest in dentistry. I had classmates that participated in like federally qualified health centers, and FQHCs are usually like medical, dental, sometimes they'll even have like PT or psych. So your involvement in the community and your dedication to your community and providing some sort of care is what's more important.
In your office, is your work as a dentist based on per diem?
Do you, if per diem means production, yes. Is that if per diem means like if you're being paid on production, that's correct. Most offices, I would say honestly, that's how everyone gets paid. Everyone that I know that I went to dental school, they get paid on production. So if you do a cleaning for $100, you will get paid a percentage of that $100. And usually it's anywhere from 30 to 40%, depending on the contract that you come up with your employer. So you don't get paid 100% of the fees. You get paid a percentage, and the rest of that money goes towards paying, the office rent, the employees, supplies, etc.
Would you recommend a gap year? And in that gap year, what do you think is crucial to do? Do you think it's helpful to take supplemental courses before dental school in a gap year?
I think it depends on your situation. Like, I personally decided to take a gap year because I wanted to demonstrate that I could handle the university course load, the university level, like upper level science courses. Like I knew that some dental schools would kind of judge me poorly for going to community college, and I wanted to show them that, hey, like I killed A&P, cell bio, microbio, biochem. Like I got an A in all those classes. I could handle the rigorous course load that is dental school. So like I said, like that was a strategic decision on my end. And that's why I decided to take a gap year. I think it really depends on your situation. Like if you don't have maybe the best GPA, then maybe you would benefit from like a 1 year's master program, so that you can demonstrate that you can handle a rigorous course load. You know what I mean? So it really depends. I personally was like, I was confident in my GPA, and I knew that I would work hard to get a good DAT score. So I didn't see the need to do like another degree program during my gap year. I just decided to work for a dental office just to kind of keep me in the game, if that makes sense. So I think that you just have to like look at yourself, like look at your stats and determine like how competitive of an applicant you are, and determine what you need to do in order to improve that particular thing, if that makes sense.
What was your most challenging prereq for dental school?
My most challenging prereq, I think anatomy was hard. A&P was really hard. It was 2 semesters, like A&P 1 and A&P 2, and there was also like a lab component with cadavers and stuff. I thought that was difficult. There are so many like moving parts, like origin and insertion and innervation and function, and like not only that, and then you have to like learn the organs and learn like endocrine system. Like there's just so much that goes on in anatomy and physiology. And I thought that that was the hardest course that I took in undergrad. But I did very well in both semesters of A&P, and it helped me so much in my first year of dental school, because our first year of dental school, we dissected for 2 semesters. So we kind of like repeated A&P again. But I think that was the hardest one. It was just like learning all the pathways and all the muscles and all the things. That one was hard.
What volunteering were you involved in?
So volunteering, I was involved with just like, there's like a small, it's not an FQHC, but it's like a community center in Chicago. I was involved with that, and like I would go and just like dental assist or help like in steri, or filling out like patient chart notes. It's called Community Health in Chicago. So I volunteered there. I also participated in one of my friends' like student orgs, and that one was for helping the homeless population or the unhoused population. I think those were like the majority of like my volunteer opportunities, but I sought more paid opportunities. Like I was an orthodontic assistant for 2 years. I was involved with like my school's freshman orientation and like welcoming the kids into the UIC Honors College and doing like student orientation, for freshmen. Yeah.
I'm planning on getting my DA license. Do you have any recommendations or advice in terms of getting a job as a dental assistant?
You don't need to have a DA license to like be a dental assistant. I would look into that if you live in like Illinois, for example, just look into like the legal requirements for a dental assistant. But I don't think it's that much of a barrier to get into dental assisting. You just have to apply and show interest and then be dedicated to learning all the things. I think that doing a program will help you kind of become accustomed to like all the materials and the responsibilities of a dental assistant, but there's nothing like just starting a job and like going for it, being trained on the spot. I actually think that most doctors would prefer to train you if you don't know anything, because they're going to train you to work in the way that they want you to work, if that makes sense. Whereas if you do a program or if you have prior experience, sometimes they're kind of like, okay, well, what bad habits do we need to break? So, I would advise you just to start looking for a job and show interest and show some commitment towards dental assisting.
And then for CE courses and implants and veneers, are those things that you are not taught in dental school, or are the CE courses more so supplementing existing knowledge?
So for CE for implants in dental school, you are taught about the process, like the theory of how to treatment plan and place a dental implant, but we do not place implants at UIC. I don't know if that's changing, if that curriculum is changing across other dental schools, but at UIC, we were not allowed to place dental implants because we have all 5 specialties like at UIC. So we had oral surgery, perio, those 2, and proths, like those 3 specialty programs. They usually would place the implants and then the dental students would restore the implant. So some of the clinical requirements in order to graduate included restoring a minimum of like 2 implants, but we did not place any. So the CE courses that I took were more so for learning how to like placing them, so that the first time you do it is not on a patient, like your first patient for the first time. It's like it's a guided teaching opportunity for you. And then I think you also asked about veneers. In dental school, we also learned again about the theory of smile design and veneers prep. Like they teach you like the lingual butt, no prep veneers or like minimal prep veneers. Like we learned like the parameters for those types of preps and like the cases in which you would use each individual prep design, if that makes sense. But again, we're not allowed to do veneers in dental school. So like the CE courses that I'm looking for or that I'm interested in taking are those that like allow you to practice those preps like on a mannequin, like you would in dental school before you do it on a real live patient.
And then without the CE courses, would you still be able to place implants and do veneer cases, or do you need that extra certification?
I think in theory you can. So like to give you another idea, like in dental school, they're going to teach you the theory of how to extract a tooth, right? You may not get the experience of how to extract like a difficult tooth until you're actually practicing out in the real world. So what does that mean? That means that I have the knowledge base of like how to do an extraction. I know what instruments to use. I know how I'm supposed to do it. And then when I'm in practice, I can do it. The same is true for implants and veneers, if that makes sense. Now, I personally was not comfortable like placing an implant without ever having some additional training or with prepping some veneers without having some additional training. So that was my decision to receive like, extra education.
Okay, I think those are the questions for now, but if anyone else has any other questions, they can leave them down in the chat. But I wanted to thank you, Dr. Luna, for taking some time out of
you.
the day to do this session with us today.
Awesome. Thank you guys so much for having me. This was fun. I hope everyone learned something. I hope it was useful. I really appreciated the opportunity.
Okay.
Thank you so much, and have a great rest of your day, everyone. And thank you again, Dr. Luna. And
Awesome.
yeah,
Thank you guys. Have a good one.
thank you. Bye.